Welcome! We are here to take you on a journey, South Carolina's journey, to implement data-based individualization in partnership with NCII, Clemson University, and an independent educational consultant. We will share with you the process from beginning to end, our key takeaways, and the positive projections moving forward. So you may wonder, why DBI? Well, South Carolina is invested in intensive intervention because we are dedicated to improving outcomes for students with disabilities and improving systemic practices at the LEA level through evidence-based practices, data-based decision-making, family and community engagement, and fidelity of implementation. Intensive intervention improves outcomes for students with disabilities and helps our students achieve equitable access and the opportunity to meet the profile of the South Carolina graduate. It was through our collaboration with higher education, specifically Pam Stecker from Clemson University, that we learned about NCII and the data-based individualization, or DBI as it's known, and the project partnership, and decided to apply for this initiative. Planning our road trip. Like all journeys, you always start with a plan, and this journey was no different. We tried to be very thoughtful and thorough when we planned this road trip. We started with educating our team on DBI. At the state level, NCII trained a considerable amount of OSA staff on DBI. This turned out to be a good move for sustainability and supporting the school throughout the project, because even with staff turnover, our journey continued without interruption, as well as the level of support given to the district and the school. OSA staff also attended all the trainings at the school level that were provided by NCII and our project partners. As we educated ourselves, we also started to gather data and information for districts within our state and met as a team to discuss which district would be the best fit. Some of the criteria we used included a school that was close in proximity to our downtown office so that we could provide relatively quick and easy support upon the school's request. We also looked at a school that had an enthusiastic special education director and a school with new leadership who both believed in the DBI concept. And then a school with demographics that were favorable with a large, diverse population. We also took into consideration that one of the districts we were looking at already had one of our partners on this journey, an educational consultant, who was working with the school on behavioral initiatives and had extensive knowledge of the district and the school. Once we decided on a district, we reached out to see if they wanted to join us on this journey. Once the partnership was finalized, we hit the road. Our first meeting was conducted at the school with district leaders, school administrators, school staff, which included interventionists, a reading coach, and special education teachers, as well as our Office of Special Education DBI team. On the road. Once we hit the road, we were making good time to get to our destination. The NCII staff provided DBI training at the school level. Dr. Pam Stecker from Clemson University provided progress monitoring training. Susan Thomas, our educational consultant, did a teams-initiated problem-solving training, and our OSA staff provided specific training to the school special education staff and worked on data-based decision-making with the school-based MTSS data team, which included the reading coach and interventionists. Our OSAS DBI team also provided follow-up support, which included reviewing school data one-on-one with staff and attending school-level data meetings. Positive relationships were built between OSAS and the school-based team, and ongoing support as needed will continue for this school year. Roadblocks. We did come up against some roadblocks along the way, which wasn't very surprising. The district had indicated that they had an established progress monitoring tool, and then midway through our training, they switched gears and purchased another tool that wasn't available and usable until January. Also, the special education teachers missed a training due to a lack of substitute teachers, and they had to be trained at a separate time. Additionally, staff struggled with looking at the data and then trying to align it to the skill deficits. And while building staff was on board with DBI, some staff at the district level, as well as some district level initiatives, didn't align with DBI. And of course, our most significant roadblock was COVID, which hit the US and halted our work just as we were getting to the point of looking at the data and seeing if progress was being made. Tolls. Like many trips, some of the roads we took had tolls along the way. These tolls provided some valuable lessons for us, though. We realized that we did not ask enough questions of the district before selecting them. We also realized that we did not give clear expectations in the beginning to the district, which affected their ability to fully commit to DBI. But the tolls weren't all bad. We did gain some positives, like getting general education to see the benefit of using data effectively. We also saw huge gains from the school-based interventionists, who acquired valuable knowledge about data, progress monitoring, and aligning interventions, which we were thrilled to see that they carried over into this past school year. And we did strengthen our partnership with the school as well. Detours. Some journeys have detours, and ours was no different. Our biggest detour was the pandemic. The pandemic put a quick halt to our work just when we thought we were starting to make a difference, and just as we were getting ready to look at our data and see their progress. Thankfully, the pandemic had a silver lining for us. It created an opportunity to have Dr. Devin Kearns speak to teachers and administrators in our state about DBI. Dr. Kearns is an associate professor of special education at the University of Connecticut, and he's a leading education researcher who studies reading disabilities. His presentation for South Carolina created a lot of enthusiasm, which led to our DBI Community of Practice with a number of our districts who attended the webinars. Arrived at destination. So while the journey has had many detours, roadblocks, and tolls, we did arrive at our destination, just not at the exact place we thought we'd be. Fortunately, the journey was filled with wonderful things. The biggest accomplishment was the relationship we built with the interventionists. They wanted to soak up any and all information they could take to make a difference with their students. They were in 100%. They asked questions, put our suggestions into practice, and called when they needed our help and helped spread the word, even when spreading the word meant they'd have to encounter resistant staff. This is significant since they are the last line before a student is referred for special education services. If they are knowledgeable about DBI, then students will get what they need to succeed, which should, in turn, reduce the number of students who are inappropriately identified for special education services when they really don't have a disability. They just haven't received proper instruction or adequate intervention. Additionally, while the pandemic was a huge detour for us and many others, it made us rethink how we could keep DBI going, and having Dr. Kearns present to a large group of teachers and administrators in our state and others, we were able to keep DBI going and on a scale much larger than one school and one school district. These webinars sparked an interest in a number of districts who will now be participating in our DBI Community of Practice. Planning our next trip. While the end of the journey was a positive one, there are things we would do differently next time. Some lessons we learned when planning for our next trip would be to do a better job of planning in advance. By that we mean making sure all staff at the school level learn about DBI. That would have made the interventionist's job easier, and it would have made the student level data meetings more productive. We would also make sure that the staff had a good foundation in MTSS. It makes understanding DBI much easier. As for packing, we would do a better job of vetting the district. We need to ask more of the right questions and make sure all district staff are on board. There's only so much an individual school can do if the district administrators aren't all on board. We would also make the expectation clearer for the district and not just the school in regards to implementation. Last, we take the right people next time. You really do need district level buy-in. Their commitment is a crucial piece of the puzzle that can easily derail the initiative. The commitment isn't just the same common belief in the initiative, which is extremely important, but a financial one too that includes adequate resources for the school so they can properly participate. An individual school on its own can only do so much. South Carolina's journey didn't quite turn out like we all dreamed it would, but it taught us a lot along the way that we can use in the future, and at least for one school, we did make a difference. We are proud of our work and very proud of the school who are continuing the use of DBI for their students academically, and now, thanks to the work of one of our DBI partners, they are using it behaviorally. As Ursula K. Le Guin said, "It is good to have an end to journey toward, but it is the journey that matters in the end."